Good morning and good afternoon. Thank you guys for joining us. This is our second Advanced Hospice Management webinar, and we have great information today for Medicare for billing updates. I just want to give you guys who are joining us for the first time a little information about our company, but also give some of our attendees a little more time to log in. Advanced Hospice Management is a hospice-only third-party independent billing solution. We are geographically dispersed, and for us that means that our billers are dispersed throughout the country. We have Mac experience with all of the different Macs, and we also have multiple software experience. We have redundancies in place for our billers and our clients to make sure that all billing clients have a primary biller and a backup biller, and our billers are available throughout your business hours, and we also have a 24/7 emergency hotline. Our billers work collaboratively to make sure that all of your claims are processed with the most recent and current Medicare information. We offer the best customer service, I have to say. Our billers are educated with the most recent guidance, which is a lot of the information I will share with you guys today. And because of our education experience, we're maximizing collections for clients. Everyone is highly trained, and our high volume experience makes sure that your claims are paid timely. This is just an overview of the items we'll talk about today. Medicare has given us quite a few change requests that relate to hospice and specifically to hospice billing. Of course, our adherence to each change request is mandatory for our proper claims processing for hospice. We have some updates to codes, some requirement changes, and some exceptions for our Medicare claims processing for change request 8877, which I'm sure everybody is really tired of talking about after a year and a half. We're going to add some clarification to span code 77, which gives us some additional use. We're going to include the requirements of the principal diagnosis on notice of election, and we're going to broaden the scope of our institutional claims format with some information about vaccination billing. So our first topic is change request 9590, and this request actually clarifies some things and gives us the addition of the new condition code 85. So change request 9590 for the new condition code basically tells us that the span code 77 on a hospice claim indicates non-covered days. However, we were using it for two different scenarios. We're using it for the non-covered days due to a late recertification of terminal illness, and we also use it for days that are non-covered due to a late notice of election. The problem with that, of course, is that Medicare claims processing didn't know the difference. So they've given us condition code 85 for claims that will have 77 span codes that are meant to indicate the non-covered days are due to a late recertification of terminal illness. So as you guys know, when you process a claim, and I'm sure probably most of you processed a claim with a 77 span code more for the indication of non-covered days due to a late notice of election, and that span code is the date range of the non-covered days. Now, on those same claims, you'll do nothing different for the late notice of election claim. But when you have non-covered days for a late recertification of terminal illness, you add that condition code 85 because there are different rules that apply. Medicare was rejecting some claims with the 77 span code for a late notice of election because that span included your 27 occurrence code date. And Medicare says we can't do that on a late notice of election, on a late recertification of terminal illness claim, but we can absolutely do it on a late notice of election claim. So again, that 85 code is for 77 span codes that document non-covered days due to the late recertification of terminal illness. So we don't do anything differently when our span code is for a late notice of election. And condition code 85 is effective for claims received on or after January 1st of 2017. Additionally, this change request actually corrects the common working file look back. And back in August, Medicare gave us an update saying that they were not correctly calculating the look back and determining how many days the patient had a prior hospice when calculating your high and low rate days. So they've given us this update saying that they have a new look back process, and the issue was that the common working file was only looking back to the most recent hospice election period prior to your admission. When a patient had an election period even prior to that one, those days were not being calculated into the count. So I'm sure you guys all know that if there is not a 60-day gap between hospice elections, between the termination of one election period and the new election period, that all of those days are counted towards your 60-day high rate calculation. Medicare was not going back past the most recent election. So if a patient had multiple elections prior to yours, they were not calculating those correctly. So supposedly, change request 9590 was going to correct this look-back process. However, today in my email from Palmetto GBA, I received an update that says, on August 18th, CMS notified hospices that Medicare administrative contractors would adjust claims to correct miscounting of routine home care dates. But due to incorrect payments, the MAC will stop adjustments until it's implemented. So 9590 was supposed to help us, and Medicare was going to automatically readjust these claims. And now that correction is on hold because they're still not paying correctly. So I guess we'll keep an eye on that and hopefully see an update soon that they've actually corrected that process. Another correction that 9590 was supposed to make, and this one we have not gotten any additional information on, so I'm assuming it stands, was that the SIA payments due from a previous month when a patient dies in the first 7 days of a billing period were not being calculated correctly. So if you have a patient, for example, that passed away September 4th, and your claim for September was all general inpatient days and no routine home care, the SIA payment obviously doesn't apply to that claim at all. But when those claims were happening, the common working file was not going back to the previous month's claim to determine whether or not you had any SIA visits that qualified for payment in those last few days of the month. So they've supposedly corrected this, and now they'll go back and recalculate those days as well. There were some other issues also with this, and from what I understand, even though the system was actually submitting, reprocessing your prior month, they were reprocessing it, and you would see an 81G or an 81I type of claim. They were not actually paying the SIA visits, even though they were identifying them on the claim. There was no additional payment. So it's very important, I think, for providers to go back into, and I'm sure we probably don't have a tremendous number of claims that the patient dies in the first 7 days of a month, but it should be easy to look back, and you can go in and verify that you were actually paid for your SIA days and visits that are qualifying visits. And I would definitely recommend that everyone do that. Even if you're spot checking, at least you know whether or not they're paying your claims correctly. Additionally, if Medicare does automatically adjust your claim and apply your SIA payment, but then you have to go in as a provider and do another type of adjustment for that claim, Medicare was recouping that money from the SIA payment. So this change request is supposed to correct those errors in processing. But I would definitely recommend that everybody follow up with your own claims and check and make sure that you're actually getting paid for your SIA visits. And one more thing that 9590 is supposed to correct. There are situations where hospices transfer a patient, and if the original transferring hospice had a late notice of election, they are penalizing the hospice, the receiving hospice, and their claims are being returned because the initial notice of election was late. Medicare says that the action of the discharging hospice should not impact the receiving hospice's payment, and Change Request 9590 is supposed to correct this. Until this correction is implemented, your MAC should override the edit that occurs in error. So if you have a claim that you submit and your patient transferred into you from a previous hospice and they reject your claim and return it to you because the notice of election was late, you should call Medicare and tell them exactly what happened with your claim, and they should manually override that error and resend that claim for processing. So that's another one you definitely want to follow up on. I'm not sure how many people are actually seeing those issues. Principal diagnosis code is now required on all notice of election. And I think I skipped the slide. Nope. So this is another change request, 9575. And now we have to enter a valid ICD-10 code for all notice of elections. And I use the word valid. I'll stress the word valid because we can't truncate our codes, obviously, and you have to enter a code. Up until this point, if you entered a code, it had to be a complete code or your notice of election would be returned. But if you didn't enter a code at all, your notice of election would process. So adding to the stress of the whole ICD-10 learning curve, we now have to make certain that we put a valid ICD-10 code on our notice of election. And I think, you know, a lot of us probably have Z56.6 and maybe Z72.820 and maybe even F15.280 related to the ICD-10 codes. So change request 9575, this just reiterates what I just said, that we now, as of October 1, have to add a valid principal diagnosis code in order for our NOEs to be accepted. And they will return any to you that do not contain one. Now, here's a new item for me. This is not something that I was familiar with prior to a recent call, but change request 9052 is broadening the institutional claims format. Basically, what this is going to do for us is allow hospices to bill for vaccines on our institutional claim forms that we already use for all other hospice services. These claims we won't be able to put vaccines on our actual hospice care claim forms. We have to file a separate form, a separate claim, I should say, because I'm sure everybody is filing electronically, but you can actually enter these directly into the DBE system. And I don't know if anybody has actually billed for vaccines, but there's new guidance here. Wrong way. So effective October 1, hospices are no longer required to obtain a supplier number and are no longer required to bill vaccines and administration on professional claims, the CMS 1500. Hospices for Medicare don't use a 1500. We use the UB04 5010 format. So Medicare will now allow hospices to bill these services using our institutional claims format. Vaccines and administration must be billed on a separate claim that includes only these services. So make sure you guys aren't adding vaccines to your regular monthly hospice claim. The type of bill is still an 81X or an 82X with revenue codes 0771 and or 0636. And there is some additional information. You may roster bill using condition code M1, meaning you can bill multiple patients on one claim submission, even though you're in DDE doing a direct data entry. And payment will be made based on the Medicare physician fee schedule and are not subject to deductibles or coinsurance. And I've added a link for further billing instructions if you guys need to review that. I'm not really sure how many are actually doing vaccines on our hospice patients. And yes, we are still talking about change request 8877. I'm not sure if you guys follow the Q&As on 8877, but they were just reviewed and updated on 924 on the CGS page. That's the one that I usually look at. But there's a couple of things I wanted to point out about this. The clarifications on filing your notice of election before previous hospice has completed processing their claim and untimely notice of election filing due to a patient error. These are just some things that we find stand out in the exceptions that maybe hospices aren't aware of or aren't using to their benefit as Medicare has laid it out for us. I attended a Palmetto GBA in-service, and our teacher there gave us a few examples, and one of the things that he talked about with Medicare as we went through the Q&As and the frequently asked questions for 8877 was we were initially told that we should enter all notice of elections within 5 days. And I think as providers, we assume, because we go into the common working file and we see that our previous hospice provider for our patient has not completed their claim, that many hospices were not entering that notice of election because they think, well, it will be returned because we can't process that until the previous hospice has completed their billing. But Medicare, because they've given us that guidance and said we should enter it, they're really reiterating that through all the MACs and all the in-services that I've heard. They're saying enter it in within the 5 days, even though you know it will go to T. Because sometimes it doesn't go to T. It might actually process if a patient is not in a current established certification period with the previous hospice, your 81A may actually process. If that happens, their guidance is that we should just back it out so that they can finish their billing, but that we've established that we've entered our notice of election within the 5-day time frame. So we definitely want to make sure that we're doing that. I don't think that Medicare is holding that against us at this point, but I think that it may come down to we will just automatically start seeing these notice of elections, and our first claim will subsequently be returned because of a late notice of election, and they may no longer accept the appeal reason that the previous hospice had not completed their billing. And, you know, we'd just like them to do that without telling anybody because it was initially in the guidance that we file these within 5 days. So my advice, of course, is to file it, and if it pays, back it out, and if it doesn't, then it just sits in T, but you have proof that you filed timely. Now, this is another example that was given to us at an in-service, and I'm not sure that everybody is aware, but if in the event that you have an untimely notice of election due to something that's out of the control of the hospice, the NOE may qualify as an exception to the 5-day rule. And we've given us the 4 reasons, and they're all a little bit out there, but we do have exceptions, obviously, and one being the sequential billing if a previous hospice hasn't completed their billing, which we just talked about. The other issue, though, that I found interesting was they gave the example of a patient that comes to your agency or is referred to your agency, and it's indicated to you that the primary payer is something other than Medicare, like a commercial insurance policy. So you have no information about a Medicare benefit at all for your patient. You're given a Blue Cross card, say, and that you call Blue Cross and they give you authorization, you bill Blue Cross, and then you get a rejection from Blue Cross saying that the patient is not primary Blue Cross, but it turns out the patient is primary Medicare. So you haven't filed a notice of election because you didn't know the patient had Medicare. So at that point, filing the notice of election, of course, will be late, and you should appeal the claim and state that the patient did not provide you with accurate information and you were unaware of the Medicare benefit. And that actually has worked on appeals because obviously you were given information and there's no way that the hospice could be in control of that knowledge. So it does work, and I definitely want to encourage you guys to use it. Further questions on change request 8877? We have a few questions that came in prior to this about 8877, and I think, let's see what I can find to tell you guys. There was some other information. One of the things that I found interesting was on an MLN Connect dated Wednesday, November 26th of 2014, Medicare says about hospice notices returned to the provider that if a patient revokes from your agency or discharges and comes back to your agency, but the patient, you could not file the final claim and you could not file the NOTR because you did not have an established cert period. Obviously, your final claim will establish a cert period. That filing that NOTR and having it go to T is considered timely. So I thought that was interesting because if you can't file your final claim, or if you actually have two claims to file, which we know how that works, if your new certification period falls in the beginning of a month and a patient discharges and you haven't filed the previous month and you need to file the current month before you could even file an NOTR, and then the patient returns to you, then you have a situation where it might be difficult to get all of those notices in within 5 days. So Medicare here says that your NOTR is considered timely. Now, whether they'll consider it timely when you appeal a late notice of election subsequent to this NOTR, I haven't done that. So I guess we'll see, and I'm definitely going to bring that information up. So that really is all the information that we have for you guys today. And if you have any questions, if you would just email it to us, I'll be happy to answer. I know that you guys have submitted some questions here, and I will most definitely answer these in an email. So if anybody has questions, please do that, and I believe that we will send out our handout today. We'll go out to all of the attendees, and on that you can respond to that email, or you can always email me here at dh@hospicemanagementmgmt.com, and I'll be happy to answer any emails, or give me a call if there's any questions at all that we can help you guys with. We'll be happy to do that. I have some additional resources about the information that I've included today, so I will make sure that that goes out with the handout as well. And I really appreciate everybody taking time to attend our webinar, and if we can help in any way, please let us know. Thanks, everyone. Have a good afternoon. We'll see you next month. Bye-bye.